Have you been told that you need fillings, or do you have any dentistry in your mouth right now that you've been told needs to be replaced? Well, this is the episode for you. Today, we're going to deep dive into biomimetic dentistry, which is a way to restore your teeth to their natural, healthy function. Please do not confuse this with biological dentistry, because biomimetics is a whole different beast. So stay tuned. Welcome everyone back to an episode of Your Mouth Matters. I am Dr. Rebecca Taylor. I am the owner of Green City Dental, a biological holistic dental practice, and Otodontics, a practice focused on TMJ, snoring, sleep apnea, and functional orthodontics. We are in Edmonds, Washington State. I'm super excited about today's podcast because we are going to be diving into the world of biomimetic dentistry. And today I have two special guests with me. I have Dr. Isabel Perez and Dr. Jeanette Carroll. Welcome, ladies.
Hello there. We wanted to let you know that, or want the audience to know that we work with you.
Yes, you do. You guys are my dream team. Honestly, I couldn't be more excited and just thrilled about both of you. And what I love about our practice at Green City Dental is that each of our doctors there kind of have expertise in certain areas. So my expertise is more in TMJ, sleep apnea, snoring, and functional orthodontics, where Dr. Isabel is more focused on the surgical side, and she does some restorative dentistry, which means like crowns and fillings. And then Dr. Carroll, who's the newer addition to our team, really specializes in cosmetic dentistry and doing a lot of restorative dentistry like fillings. And I'm super excited to go into this topic, ladies, because, I don't do a lot of fillings but I think that Green City Dental, we are all about make sense dentistry, right? I think I could make that our catchphrase, right? We do dentistry that makes sense. And one of the things that we have incorporated into our practice is biomimetic dentistry. And it's important that you understand that biomimetic dentistry is not biological dentistry. Okay, they are different, even though they sound kind of similar. A lot of people kind of blend the two together, and they're like, "Oh yeah, I'm a biological dentist," and I just assume that you're a biomimetic. But that's not the case. Okay, most of the biological dentists that I know actually are not biomimetic dentists, and you can be a biomimetic dentist without being biological. So it's important to understand the difference, and we're going to dive into more of the details today. But biomimetic dentistry is essentially, if you break that word, you have bio, which is life, and you have mimetic, which is mimic. So we're mimicking nature, basically. And so whenever we are looking at somebody, we're always focusing on the functionality of the way that the teeth come together, the way that you're chewing. And we want to make sure that the dentistry that we put in your mouth is going to last the longest, and it's going to really replicate how your teeth are supposed to work naturally. So ladies, you have way more expertise in this topic than I do. I think it's really cool, which is why we do it at Green City. But can we just talk about like the foundations of biomimetics? What is it? How did it come? So take us through that.
I know we've done a podcast on amalgams with the mercury in it, but let me just briefly talk a little bit about the amalgams. The silver mercury fillings that we put in the past didn't have any glue that held them in. So the standard of care was to do what we call extension for prevention, which was to drill out your grooves on your tooth, even though there's no cavities there. We were drilling that out to prevent a cavity from happening. And then, of course, the American Dental Association was not keen and not supportive of us replacing these fillings. And a lot of us were concerned about mercury at that time, and the American Dental Association didn't support that. But what we discovered is that these silver mercury fillings set up with an expansion property. They expanded, and that set up these microfractures inside the tooth. And so a silver filling left long enough would eventually you could start really seeing the cracks. And so
an interesting fact just to throw in there is that the American Dental Association actually has stated that 80% of the time a tooth will crack after an amalgam filling is placed.
Yeah.
That's the statistic from the American Dental Association.
That is really interesting, isn't it? So we really started, the research started going down the rabbit hole and trying to find something that would help hold the tooth together. And so that's really what happened. Bonding is really about glue. Mm-hmm. And what we're trying to do is we're trying to glue the tooth together so that it doesn't have as much cracking as it would with the mercury silver fillings.
Yeah. When we talk about bonding, we need to understand that every part of the tooth has different strengths, has different functions, and we are trying to mimic that. We're trying to mimic the shape, the natural form of a tooth structure. When we use the bonding, we're minimizing pressure, but it has to be done the right way. And that's when biomimetics come into place. Because a lot of people are using composite or bonding restorations, but they're using different techniques. And they have done a lot of studies where incremental layers, yes, it can create strength on that layer, but at the same time is moving the shape of the tooth, is just bringing those cusps or those walls of the tooth structure together, putting them together. And then we can see crack lines with those restorations. So we need to make sure that when we're doing the biomimetic restoration, we're trying to conserve first tooth structure. We want to try to preserve the pulp vitality. And that's one of the biggest reasons of why at Green City Dental we're doing biomimetics. We want to try to avoid as much as possible any problems with the nerve or the pulp of the tooth. We're also trying to prevent failures. We don't want to cause more strength or more force that is not correct for the tooth. We want to try to preserve that natural form of the tooth. And then we want to try to restore those teeth that are not restorable. A lot of people go and have a tooth that is really destroyed. There is not a whole lot of tooth structure. You go to another dentist and they will say, no, we cannot save this tooth. But with biomimetics and the way we do the restorations and the way we understand the bonding, we are able to save teeth that maybe other dentists are not able to restore.
That is so awesome.
Yeah, so the biomimetic approach to bonding, what we discovered was that if you didn't do the bonding right, you'd have a weaker bond strength. And that's exactly what Dr. Perez is talking about, that dentists would look at a really badly destroyed tooth and say, we have to extract it. Whereas the research now suggests that when you really approach that slightly differently, you can really increase that bond strength tremendously. So in biomimetic world, we're saving teeth that were in the past considered hopeless.
That's awesome. I mean, it's interesting because the history, we really only had amalgam back in the day as our option, that and gold crowns, right? And then we found, obviously, we don't like the mercury in them, but they expand, which puts pressure on the tooth. Mm-hmm. And so you have this constant pressure and you have hot and cold, which is causing this to contract and expand. And so that's why 80% of these teeth are going to have cracks in them. And if that crack goes really deep, you have the potential of losing that tooth, because if you get a vertical crack all the way down the root, that's not savable, right? So I think the dental world was like, we need a different solution to this. And so they came up with composites, white fillings, right? So we've been talking about bonding. Bonding is called white fillings, where we use composite, right? And the technique that I learned in dental school is that you layer that composite in a few millimeters. And we know that when we put our light on it, our blue light, it shines on the composite, it polymerizes, and it causes that to turn hard. But when that happens, it actually shrinks. And so while amalgams are putting pressure and pushing out, composite fillings are pulling in, right? And so back to what you were saying about when things shrink like that and they pull, that's going to pull on the sides of the teeth. And what happens is that when we get that pull, there's a little gap that forms between the filling material and the tooth.
Yeah.
Right. And so this makes it easier for bacteria to get underneath your filling. So a lot of people, if you look at the current studies, average filling lasts 7 to 10 years. That is the life expectancy of a filling. And I would say that with biomimetic dentistry, one of the awesome advantages, because we have the way now to reduce that shrinkage and reduce that gap between that filling and your tooth, so there's going to be less leakage, you're going to find that you're replacing your fillings a whole lot less because of that technique that we're using. And unfortunately, as you ladies know, it takes a lot longer to do a biomimetic restoration, because if you just bulk fill, so if you just put your composite and you squish it all in and you fill this tooth really, really fast, you're going to have more shrinkage versus doing tiny, tiny little layers and making sure that you are very conscious about how you put the filling material in and where you place it so that you reduce that shrinkage, right? And that's going to help not only get it so that that gap between the tooth and the filling is smaller or not there at all, but it's also going to put less pressure on the pulp of the tooth. A lot of people get sensitive teeth after they have composites placed, and they're like, why are my teeth sensitive? They've never been sensitive before. If you have that shrinkage, that's pulling on the nerve of the tooth, and that nerve is connected to that filling because there's tubes full of fluid, right? Mm-hmm. And so when that shrinkage happens, it pulls the fluid and it's literally pulling on the nerve of the tooth. So if you can do everything to reduce that from happening, which is biomimetic dentistry and biomimetic principles, you're going to have a filling that lasts a lot longer. You're also going to have a filling that's potentially going to be, like you said, protecting the nerve of the tooth and less damaging. So that's going to prevent the need for root canals. And it's going to allow us to save those teeth that were deemed unrestorable, because the techniques in biomimetic dentistry are able to build that tooth back to its natural strength and function.
And one of the things that people need to understand is it's not necessarily that doing a composite or resin filling or bonded filling is the only solution. And sometimes it's not, because we're trying to prevent that leakage, that micro leakage that is presented, because every single composite is going to be shrinking no matter what. So then if we have a microscopic shrinkage and leakage, then we're going to have decay after the maybe a few years later. Then also we're going to have some sensitivity. The patients are going to have more sensitivity. And if we're talking about a big surface of tooth that is missing because there was a large decay, we need to start thinking about different restorations. And this is when biomimetic is coming handy, because we need to decide, okay, is this beneficial for the patient? We're going to provide them a biomimetic composite, or is it going to be better to do an indirect restoration, meaning that we're going to have a lab fabricate a restoration that we know when we cement a restoration that the lab fabricated, there's not going to be any shrinkage. There is no changes in the tooth structure, less pressure, more strength. So a lot more benefits, less chances of secondary cavities, less chances of pulp sensitivity. So there is a lot of controversy about, okay, do I do a composite, a large composite, and just call it quit? Or do I do something that is going to last me longer and is going to be more beneficial for me?
Yeah, it's really interesting, because when you cut the tooth on a marginal ridge, so if you have a filling that's 2 surfaces or more, as soon as you cut that ridge out, you lose 60% of the strength of that tooth. And a lot of patients come in and they have both of those ridges removed, and they've got these gigantic fillings. And so when they are in our chair and we see that there's a cavity around them or they need to be replaced, a lot of the times, people think that they can just do composite fillings to replace those. And if you go to most dentists, that's what they'll do. They'll gladly, drill out the old filling and then put a huge, gigantic bonded filling in.
And the problem with that is if they don't do that from a biomimetic standpoint, they're really creating a situation for more fractures inside the tooth. So what I love about biomimetic group, this is a group of dentists, is that they're really looking at the research that's come down. They're really paying attention to that. And we've learned so much more since when bonding first came on the marketplace on how to place them. And that's what Dr. Perez and I are really focusing on, is focusing on the way that we actually place these bonding agents and the way in which we fill that hole up with that, and we end up deciding at that point whether or not the tooth will be strong enough for a direct composite restoration, or if we need to change that and do something that's more lab fabricated, much more stronger, much more ability to withstand all the chewing forces. And that's just a call that Dr. Perez and I get to make when we're in there.
I would also say that an indirect restoration, like an inlay or an onlay or a crown, may actually be more biocompatible with the body too, because these materials are porcelain-based, so they're more of like glass structure versus our composite materials, which are more of a plastic. And there's so many things out there about, BPA being bad, or, and then they replace it with like bis-GMA. Is bis-GMA better? Like, we don't know because we don't have the studies on it yet, right? So I think that when we look at being a biological office, we're always also concerned about the materials that we're putting in people's mouths. And while composite typically comes back as being pretty compatible, the idea of having a plastic in your mouth and the heat and the contraction and all of that and grinding on that all day long, if you clench and grind your teeth, like, what is that doing to the rest of the body, right? So I think it's a big question mark. Like, we don't really know yet because bonding is relatively new. But I think in my own mouth, I would much prefer to have a porcelain material that's going to wear less and is more glass-like, right? And then the only thing that you really are putting in the tooth that is the glue. And the glue is, it's a very thin layer, right? And there's going to be, it's going to last longer, and it's going to look prettier because the lab can fabricate it to match your tooth and be very, very aesthetic. And it's also going to help prevent root canals or other pulpal damage from happening. So,
on a side note, what I love about this white porcelain or even white composite material is the fact that we can read what's happening underneath them much better than we could ever with a gold crown or an old silver mercury filling. We can't see what's going on underneath there. We take an x-ray and we just can't see it. And so what happens is a lot of leakage happens underneath metal crowns that can just go for years without us seeing it. And then we take these crowns off because we start seeing problems visually on the outside of them. And there's just a big problem underneath them. So I love the porcelains or the white restorations for another reason, is for that reason alone. I can actually read them better than I can with the metals in the mouth.
And it is important for people to know that when we have a metal restoration in a mouth, either amalgam or a gold crown, or even a PFM, which is a porcelain fused to metal crown, we are increasing inflammation in our body. When we remove metal restorations, we decrease inflammation in the body. And then also, if you're having a restoration in an area that is running a meridian, for example, in your body that is connected with your liver or connected with your kidney, and there is a metal restoration, it is blocking the energy flow on that meridian. So removing those restorations and restoring them with composite fillings or with indirect restorations, like we were talking about, the inlays or onlays. And for people to understand, the inlays are kind of like a filling that doesn't include the outside of the tooth. It's just on the inside. And the onlays are a little bit bigger restorations that cover either part of a cusp or a larger surface on the tooth. And this is something that I really want to talk about, that onlays versus complete crowns are really a big difference and is a big part of the biomimetics, because when we're trying to save tooth structure, we're trying to preserve as much as possible from the tooth that is still in good condition. When we do a crown, which is a full coverage of the tooth, we're missing we're removing at least 60-70% of the tooth structure. Versus when we're doing an onlay, which is a larger restoration, but not as large as the full crown, we're preserving tooth structure and we're allowing the tooth to absorb all the minerals, all the nutrients that are coming from the mouth, going inside of the tooth. We're allowing the vitality of the tooth and the nutrition that it needs to just complete its course.
Yeah, I think I always tell patients this, like, we want to preserve as much tooth structure as possible. and we want to give you something that's going to last the longest. So many patients come in with a treatment plan from another dentist that says, I need crowns on all of my back molars. All of my old amalgam fillings are cracked, and the dentist down the street is saying, I need crowns on everything. And the thing is like, to your point, you're removing all of this extremely healthy tooth structure that's perfect surface area for bonding.
It hurts my heart every time.
I know, me too. I'm like, I'm so glad you found us. I'm going to help your teeth. Like, it's the little victories, But yeah, like, we rarely are doing full coverage crowns at Green City Dental because we have the knowledge and the ability to do the biomimetic dentistry, which allows us to preserve so much more of the tooth structure. And the thing is that, okay, let's say in 20 years you need that replaced or something. Okay, fine, do a crown. But if the longer that we can push that out, because the thing is, I always tell patients that once you drill on a tooth, you're married to the dentist. You are married to that dentist. Fillings are lasting 7 to 10 years on average. Now, I would say that biomimetic fillings are going to last a lot longer than that on average. But, the current filling materials that we have are lasting 7 to 10 years. Most patients, when I tell them this, are like, nobody ever told me that.
Or even less, because even insurance companies, they pay for a filling. No, actually, three.
Every three? Oh my gosh.
Years.
That's just that's like getting a new iPhone.
Every 3 years.
Every 3 years, you just get your fillings out. But you have to remember, every time that you go back to that dentist, they're going to drill that filling out. There's probably going to be a little bit of decay underneath. And so they're going to make that bigger. And every time you go back, they're going to cut more and more and more tooth structure away. So the less times that you have to touch a tooth, the better it is for the long-term longevity of that tooth.
That's right. Better for the health of the
Better for
nerve.
the health. Yes.
Yep.
And it's really important that we keep our teeth. We don't want root canals. We really don't want root canals. We have a whole podcast talking about root canals, but we also have proprioception. There's so much benefit to having our teeth in our own head. And a lot of times patients come in and they're like, just take them all out and give me dentures. And I'm like, I will not do that for you. You got to find somebody else, because there is no way I would ever wish that on anybody, If you can keep your own natural teeth and you can prevent the need for root canals, to me, that's just a slam dunk.
Yes, absolutely.
The one thing about crowns, too, is they're harder to read when you go in and do an examination on them. They're simply harder to read. They're below the gum line, which is another issue, too, because now you've got an unnatural product that's sitting below your gum line. And so the gums, like you said, with inflammation, the gums can react to that. And so what we really want to do is we really want to have, if we can, we want all our edges, all our margins to be above the tissue. The tissue is so much happier being against its own tooth. Mm-hmm. And so that's what I love about the minimal dentistry that we are doing, and that is that the whole body, like you said, Isabel, the whole body is just responds better to that. And if for some reason there's a problem with them, we can see that so much easier when the margins are above the gum line, because the problem is going to happen. If there's a problem that's going to develop, it's going to happen right where that material touches the enamel, right where that interface happens. That's where, if there's going to be any problem, that's generally where that's going to be.
Well, it's crazy because, at our office, we use a perioscope, which is a tiny little camera that goes underneath the gums. And, a lot of people get recession around crowns because there's still cement that's left down there. And the dentist will clean, and they'll go into the hygienist and they'll clean, and they religiously go in every, 4 to 6 months, and they're still getting recession around these teeth that have had crowns on them. And if you take a microscope, if you take a camera down that pocket and you go right where the junction, the seam, where that crown meets the tooth, most of the time, you're going to see that there's a bunch of cement that didn't actually get cleaned up microscopically, and that creates inflammation. And so again, to your point, if we can keep that margin, that seam between the tooth and the material for the crown or the onlay or the inlay or whatever, if we can keep that above the gum line, that's going to help your periodontal health. And then we're going to be able to actually see, if there is extra cement. So I think, a lot of times most dentists aren't using a perioscope to go down and see. But when we take that scope down, it's crazy how much cement is still under the teeth. And we see this with kids that have had braces and bands, and, this cement just stays in for years. And that can a lot of times just be the cause as to why you have periodontal disease and recession in the first place.
It's incredible. We had a patient, and he was around 50, and he had braces in his teenage years. And there was an area that was consistently inflamed, and we didn't know what it was going on. And when you look under the perioscope, then we saw there was cement from when he was a teenager with bands. 30-some years later.
Oh my gosh. And then I think that our hygienist broke that piece off, and then there was actually pus that came out of that area, which wasn't even evident before. And then I know the update is that bone is actually filled back in because we removed the irritant, right?
Yeah.
So anyways, it's not just about there's so many benefits to biomimetics, right? And that's why we do it at Green City, because we are committed to doing make sense dentistry. We want to make sure that we are providing our patients with the highest standard of care, above the standard of care, really a higher standard of care. And it's just one of those things that we can't, for me, I can't ignore the fact that there is a better way to do fillings than what I was taught in dental school. And, you ladies, you can't just be a biomimetic dentist, right? It's not like you take this, online one-day class, right? This is a technique that it takes hours and hours and hours of learning and practicing to do. And that's one thing that if you are shopping around for a dentist and a biomimetic dentist, I would ask them what their training is, because there is a lot of people that they're like, oh yeah, I'm biomimetic, nature functional, that's what I do. But again, just like with biological dentistry or holistic dentistry, the standardization of what that actually is not always, there isn't much of that. So I love that both of you have gone through several courses in biomimetics to learn about, some bonds are better than others, and some filling materials or materials that you would use for a crown or an onlay or an inlay are going to be better than others, right? So it's not just about the technique, it's also about the material that you're using.
That's right. And on a side note, I've had patients say that they've had porcelain done in their back teeth, years ago, and they all cracked. So they don't want that anymore. Mm-hmm. They want gold or something else, right? And the technology has just blown through the doors on the strength of these materials. It is just not an issue anymore. The materials are amazing.
Bonding airplanes together these days or something?
Yeah, that's right. They're making resin bicycle frames, and they've got an all resin airplane I think they're developing. So this technology is just really taken off. And so we're really proud at Green City Dental that we can offer what we consider to be just a higher level of care when we start focusing on the biomimetic aspects of the restorations.
Yeah. And I think that, like I mentioned before, a lot of patients will come in. A lot of patients will come in and expect that they can have their fillings replaced with just a normal composite filling, because that's what the other dentist had told them, or that's just what they think. And when you come to Green City Dental, we are looking at it with different eyes. We're looking at, okay, how can we restore this tooth back to its natural state, its normal strength? How can we make this last the longest for the patient? And so our treatment plans that you get when you come into Green City are going to look a lot different than what other dentists might present to you. Other dentists, like I said before, might just say, okay, we can do all fillings on these teeth. And at Green City, we might say, this tooth really needs an inlay. This tooth really needs an onlay. We're looking at cracks, we're looking at the function. And because this type of dentistry takes so much longer to do, and it's a lot more technique sensitive, it is more expensive. And so I just want to I think it's important that we address that. And, you can choose to just do a filling on your tooth. But like we had talked about before, if that tooth has cracks already and is already weak, you're going to be on that train of needing that replaced over and over. And you're going to be at a higher risk of needing a root canal later. So I do believe if you do the biomimetics and you pay for the right type of restoration at the beginning, you actually end up paying less money long-term on that tooth, because a dentist has to touch it less when you commit to doing biomimetic techniques.
That's right.
So, all right, ladies. Well, thank you so much for coming. And, we are just Super, super excited at Green Sea Dental to be incorporating more of these biomimetic principles. Like I said, it totally makes sense dentistry. And Dr. Carroll and Dr. Isabel are extremely trained. And if you have concerns about your fillings, you're interested in getting your mercury out, or you know you have some old dentistry that just needs to be replaced, call our office and set up a consultation with one of them. They are awesome. Till next time, remember, your mouth matters.